Welcome to the introduction to clinical documentation improvement brought to you by AAOMCP, the American Association of Medical Coding Professionals. So this is just a brief overview to get your feet wet, get in the pool, swim around a little bit, and we will certainly be taking deep dives into all aspects of clinical documentation and clinical documentation improvement. So clinical documentation is the backbone of healthcare. Look, nothing in healthcare happens, should happen without documentation. Okay. It's central, it's essential, it's critical. It serves as a comprehensive record of a patient's medical journey. And with many stakeholders, many players, many participants, many providers, many pieces of data and information. So it goes from symptoms and diagnoses to treatments and outcomes. Beyond its role as a historical record, clinical documentation is a critical tool for healthcare professionals ensuring accuracy, compliance with regulations, and the delivery of quality care. In this program, we will explore the fundamental aspects of clinical documentation, including its importance, key principles, and guidelines, the definition of clinical documentation, and the reasons for clinical documentation improvement. So, I don't know if we can pigeonhole a definition to a single definition, but let's start here. Clinical documentation refers to the process of recording patient information and care-related activities in healthcare records. So that is element number one, very, very, very basic. It does encompass various forms of documentation, including medical charts, electronic health records, progress notes, diagnostic reports, lab reports, imaging, tracings, what have you. Okay. Clinical documentation captures a wide range of data, such as medical history, physical examinations, laboratory results, medication orders, treatment plans, and patient outcomes. And so, and as we go through here, you're going to see, each spoke on this wheel plays an important part. So let's look at some of the key importance elements of clinical documentation. It's because it's not just paperwork or not just a data file. It is the lifeblood of healthcare delivery. Its importance spans various facets of the healthcare ecosystem, and as we said earlier, the patient's medical journey. Okay, and so number one, patient safety. Accurate and comprehensive clinical documentation helps prevent medical errors, ensuring the right patient receives the right care. And with this module will be an audio recording from a practicing physician that I believe you should listen to really drive this fact home. Legal and regulatory compliance. Healthcare providers must adhere to numerous regulations and legal requirements, and they span a range of agencies, a range of reasons, and proper documentation is essential to demonstrate compliance and protect against legal and other challenges. Reimbursement and revenue cycle. Inaccurate or incomplete documentation can lead to delayed or denied claims affecting a healthcare organization's revenue. It could also lead to, fraud, waste, and abuse concerns. There will also be another video with this that I think is important, for it may not be necessarily in a reimbursement and revenue cycle realm, but it really will drive home how an error can explode into a much bigger situation. Continuity of care. Clinical documentation serves as a mean of communication between different members of the healthcare team. It allows for seamless transitions of care, even when patients move between providers or healthcare settings. And one of the, I think one of the, this is not necessarily documentation, but I think it will, resonate. If you've ever seen somebody who has a medical alert bracelet, right? For diabetes or having a pacemaker or whatever, that is a essential piece of communication that can be extremely critical at a given moment. Okay, and so documentation is as important as that medical alert bracelet. Okay, and quality improvement. Analyzing clinical documentation data helps healthcare organizations identify areas for improvement, implement evidence-based practices, and enhance the overall quality of care. So what are the reasons that we have this thing called CDI, clinical documentation improvement? It's an ongoing process aimed at enhancing the accuracy and completeness of clinical documentation. Several reasons drive this need for CDI. And as we just mentioned, quality of care. Improved documentation supports better clinical decision-making, leading to higher quality patient care. And of course, we could look at that, turn it a quarter turn, and inaccurate documentation could lead to inaccurate or ill-advised clinical decisions, right? Reimbursement, optimization, accurate documentation ensures the healthcare providers receive appropriate reimbursement for services rendered, reducing financial strain on organizations, and also reducing financial strain on those who pay for it. And, right now, the federal government is the largest payer of health services in this country. And right now, they are really focusing on fraud, waste, and abuse, and improper payments. And so, you could look at it one way. You can say, well, inpatient, which is paid on a DRG, which relies heavily on, clinical documentation to arrive at a DRG, and inpatient stays are typically high ticket, expensive, reimbursement type situations. But on the outpatient basis, while each individual claim may not necessarily be as high ticket as an inpatient claim, you have far more of them. And so, it really does, bring things into balance. And so, obviously, medical providers want to be paid what they are due. Those who pay for it want to pay what is due, but don't want to be overpaying. Okay. And so this all comes from the clinical documentation. Legal protection. Comprehensive documentation protects healthcare providers against legal challenges as it provides a clear account of patient care. And data analytics and research. Robust clinical documentation is essential for data analysis, research, and population health management, which is if you look back at COVID-19, okay, or any it doesn't have to be a pandemic or an endemic, any significant condition across a population, diabetes, heart disease, cancers, statistics drive certain forces within these to better the treatment for these conditions, etc. And so it's critical in all ways. So what are some key principles and guidelines? So effective clinical documentation is guided by key principles and guidelines that ensure its integrity, accuracy, and its utility. Accuracy and completeness. Documentation must be truthful, complete, and free from errors. And of course, nothing in life is perfect, but it should be the goal to strive for error-free. and not be ambivalent or complacent about errors. Every entry should reflect the patient's condition and activity accurately. Timeliness. Timely documentation ensures that information is available when needed for patient care, for billing, for legal purposes, etc. And, another aspect of that is, the further one gets from the point in time, the fuzzier details will be. So, documentation should be performed in a timely fashion. Privacy and security. Protecting patient privacy is paramount. Compliance with regulations such as HIPAA is essential. Legal and ethical considerations. Healthcare professionals must be aware of the legal and ethical implications of their documentation. This includes informed consent, advanced directives, end-of-life decisions, also orders, properly authenticated and valid orders. Just a great number of legal and ethical considerations. And interdisciplinary collaboration. Effective healthcare requires communication among different disciplines. Clinical documentation should facilitate this collaboration, ensuring that each member of the healthcare team has access to relevant information. We've all heard specialist, maybe a primary care physician refers one of their patients to a specialist. Okay. Well, what's the value of, of a patient seeing a specialist if the findings, the observations, the conclusions of that specialist are not, communicated back to the primary care physician or others who may, end up being involved in the process of that patient's care. So CDI specialists serve as a bridge between clinical care and many, 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 many administrative processes, working diligently to ensure that clinical documentation is comprehensive, accurate, and aligned with the highest standards of care and observance and adherence to guidelines. Their efforts contribute to better patient care, regulatory compliance, revenue optimization, and the overall efficiency and quality of healthcare delivery. So it's an important role. Focusing on improving the quality and accuracy of clinical documentation within healthcare organizations, the role encompasses various responsibilities aimed at ensuring the medical records accurately reflect. That's that is, if we could boil it down to two words, accurately reflect the patient's condition, the care provided, and the severity of illness or conditions. So let's take a look at some of the key elements here. Reviewing clinical documentation, CDI specialists review medical records, including physician's notes, nursing documentation, diagnostic reports, to identify inconsistencies, gaps, and opportunities for improvement in the clinical documentation. And we have a extensive library of CDI modules that I encourage you to view as many as you can. Each brings valuable insight to specific topics and just broadens your horizons and your awareness as a CDI. Clarification and querying. When CDI specialists identify unclear or incomplete documentation, they initiate queries or communicate directly with healthcare providers to seek clarification and additional information. This ensures the medical record accurately represents the patient's condition and treatment. It was funny, I was having a conversation with somebody recently, and they said that they had been told that in the outpatient world, they couldn't query the physician. And I almost fell off my chair. CDI is not location specific. Okay. I told the person, I worked in an orthopedic practice, and while I may, if I came across something in a record that wasn't clear, or I needed more information on, etc. It was a 10 surgeon orthopedic practice. Each surgeon had a PA, so we had 20 providers, but it was pretty common practice if I saw, say, Dr. O, had some deficiency in his record, I could walk down from my office to Dr. O's office and say, hey, Mike, this is missing or this is unclear, and is there a way you can make that more clear? Okay, so that was an in-person query or request, and I would check later that day, the next day, whatever the time frame was, and I would see if the situation was resolved. So that was kind of informal CDI, and that in some medical practices that is the method. Okay, and it's still CDI. Now, the best practices is to have these things documented, etc. But we got to face facts. In smaller or more familiar or certain environments, a verbal request for clarification can still occur. Educating healthcare providers. CDI specialists educate healthcare providers on the importance of accurate documentation, coding guidelines, and the impact of documentation on patient care, reimbursement, and quality metrics. They facilitate ongoing training to enhance clinicians' understanding of clinical documentation's role in healthcare. Let's face it, folks. Medical providers have a lot on their shoulders. They keep a lot of balls in the air at one time, and their purpose, their mission, the reason they do what they do, the reason they decided to get into what they do is patient care. Okay, so it's understandable that some of the peripheral requirements are not their first priority in their heart and soul, their mind, etc., but they are still required and they still must be complied with. And so CDI specialists can really help reinforce some of these things to providers and help them integrate them into their workflows so that they are not obstructive, they're not a burden. Coding compliance. CDI specialists work closely with medical coders to ensure that diagnostic and procedural codes assigned to the patient records align with clinical information documented. Accurate coding is essential for proper reimbursement and accurate data reporting. So one of the things that separates a medical coder from a CDI person is again, the CDI is a liaison. Okay. And really, it really has two essential toolkits: the clinical knowledge and clinical, verbiage, clinical understanding, and then the other, it doesn't have to necessarily be coding. It could be regulatory. It could be other things. But they're a liaison between clinical, clinicians, practitioners, and other stakeholders. Okay. And they specialize in forensically, reviewing the records and identifying opportunities for improvement. Okay. Severity and risk adjustment. CDI specialists assess and document the severity and complexity of patient conditions. This information is used for risk adjustment models, which can impact reimbursement to health plans, quality reporting, and population health management. Quality improvement. They contribute to quality improvement initiatives by identifying trends and patterns in clinical documentation that may point to areas needing improvement. This can lead to enhanced patient care and compliance with quality standards. And so again, as I said, CDI specialists are liaisons to many stakeholders. And in the quality world, you may have heard of something called HEDIS, and if you haven't, I'm not going to give you a course. Stop here and give you a course in HEDIS, but that is a significant quality driver, as others are under MACRA, et cetera. And so CDI specialists really do help optimize quality measures through their efforts to improve documentation. Okay. Data analysis and reporting. CDI specialists analyze clinical documentation data to identify opportunities for process improvement, adherence to best practices, compliance with regulatory requirements. They may generate reports and share findings with healthcare leadership. These are called metrics. And we'll certainly delve more into metrics down the road here. Again, regulatory compliance, compliance with regulations, ensuring that clinical documentation complies with legal and regulatory requirements, such as those related to the Health Insurance Portability and Accountability Act, HIPAA, and Medicare, Medicaid guidelines, COP, conditions of participation. Okay, and there are some CFRs, Code of Federal Regulations, that specifically mandate certain, record requirements. Patient care enhancement. Now, this may be labeled number 9, but I think patient care is number 1 always, right? Improve clinical documentation translate into better communication among healthcare providers, resulting in more informed clinical decision-making, patient safety, and continuity of care. And again, please listen to the 3-minute audio from our physician. I think it's really important. Supporting revenue cycle. CDI specialists play a role in optimizing revenue cycle management by facilitating accurate coding, and accurate coding results in accurate reimbursement, reducing claim denials, enhancing the billing process. And again, it keeps in balance. Providers getting paid what they should, while payers paying what they should, and keeping those things aligned. Continuous learning. Staying current with updates in medical terminology, coding systems, healthcare regulations is crucial for CDI specialists to perform effectively in their role. And again, as a liaison, providers are not going to, make it their number 1 priority to stay up on all these. There's so many different regulations, even in the clinical space. There's regulatory changes, industry standards that they would certainly focus on first before administrative. So again, CDI specialists can be the shepherd, of the clinical flock there. Interdisciplinary collaboration, collaborating with various healthcare professionals, including physicians, nurses, coders, administrators, is essential to achieve accurate clinical documentation and improve patient outcomes. And, we're going to, patient outcomes, number 1. Compliance and other outcomes, number 2, 3, 4, 5, but all equally important. But of course, there's nothing, without optimal outcomes and patient safety and accurate and appropriate patient care, there's no point to anything else. Success in the field of clinical documentation improvement requires a constellation of knowledge and skills that combine clinical understanding, regulatory compliance, effective communication, and collaborative teamwork. And as a medical coder, I know medical coders who never talk to anybody. Okay, especially in this world of remote work, they see a record, they code a record. Okay, that is one distinct difference between a CDI specialist and sometimes in this field there is no there's no compartmentalization, absolute compartmentalization. A medical coder can wear both hats, be medical coder and CDI, can be medical coder and medical biller, so There's many in this field who wear multiple hats, but just focusing on the role of clinical documentation improvement specialists, effective communication is, and collaboration is critical. Success in the field of clinical documentation improvement requires a multifaceted approach that combines that clinical understanding, the knowledge of regulations, and being vigilant to compliance, effective communication, and collaborative teamwork. These are all, keys to success in the role of a CDI. So here are some key elements for achieving success: striving for knowledge of clinical understanding. CDI specialists must possess a strong foundation in clinical medicine, or, look, don't confuse a CDI with being, at the level of a clinical practitioner. Okay, but you can't do this without a foundation in, and you can't do this with longevity without learning something from each case that you work on. So you are constantly building knowledge, but you have to understand disease processes, treatment modalities, medical terminology, all of these things. So, clinical knowledge is essential for this thing that, this role that has clinical in its title, right? Regulatory requirements and guidelines. So proficiency in healthcare regulations and guidelines, ICD-10s, procedures, DRGs, what have you. And, look, if you're an outpatient CDI, you may not necessarily need to, you may not necessarily work with DRGs. You may work with APCs, right? But it's essential to have these regulatory requirements and guidelines, okay? And staying up to date, okay? And that's, again, remember the liaison. It's the role of a CDI to be that that watchman for, or watch person for, changes, so that they can collaborate and communicate these to providers and integrate them into workflows. And so, remaining current on changes. So, whether whether it's the, industry communications, whether it's, CMS news portal, what have you, okay? Remaining current on changes is essential. Communication with stakeholders, absolutely. If you are not interested in communicating, or not effective in communicating, it's going to be a long road. CDI specialists must engage with various stakeholders, okay? Physicians, nurses, administrators, coders, to achieve this thing called CDI. And, CDI used to be clinical documentation improvement, and now some have adopted the term clinical documentation integrity, and it's both, and so, again, you should, to achieve that, we must have communication and collaboration. It's a team effort, okay? Remember, there's no point for a liaison if there's no liaising. So, a CDI specialist is a collaborator, okay? Is the ringleader of sorts, okay? Attention to detail, absolutely critical, okay? CDIs must be meticulous to whatever comes their way, and it can be such a spectrum of different things, from one record to another. So, but they must be able to identify gaps, inconsistencies, contradictions, ambiguities, what have you. So meticulous attention to clinical nuances, because even minor inaccuracies can impact patient care and reimbursement. Data-driven insights, as I mentioned, we'll talk more, throughout the program about metrics, utilizing data analytics and reporting tools to identify trends and patterns in clinical documentation. Data-driven insights can guide targeted improvement efforts and highlight areas for focus. And one of the things that we will cover is what's called the case mix index, and that is one of many metrics. And so, we will certainly dive into data-driven insights in the program. Commitment to quality improvement. Okay, and generally, CDIs are all about the commitment to quality improvement. They have to be somewhat of a statesman or a statesperson. They have to be somewhat diplomatic. They have to be, wear many different hats, a motivator, et cetera, to engage clinicians to foster that same commitment to quality improvement. So embracing a continuous improvement mindset and acting on identified areas for enhancement, providing feedback to colleagues and seeking opportunities to refine documentation practices. And, again, when you have a list of things, if it's an ordered list, numbered list, number 9 does not necessarily mean last or least less important. Ethical practices, for example, when constructing a query, there's ethical concerns, ethical vigilance that must be maintained. So maintaining highest ethical standards in the CDI. Among them are respecting patient privacy and confidentiality, and ensuring that all documentation is accurate and honest. So what should be in clinical documentation? And this is certainly not a complete list, but it's kind of a categorical, overview. Certainly physical evaluation, clinical evaluation. So, physical evaluation would be, direct observation of patient and their habitus. Okay. Clinical evaluation would certainly be, reviewing either labs or, things that are recorded that are not necessarily a direct observation of the patient itself. Diagnostic evaluation, results of different diagnostic studies, whether they be labs, whether they be, imaging, electrophysiologic, like EKGs or something like that. Therapeutic should be, all therapies, from medications to physical therapy to, psychotherapy, whatever. All therapeutics should be, listed accurately in the clinical documentation. The level of care required, okay, that should be certainly included in the documentation. And assessment, okay. The treating or attending provider is responsible for, in that particular instance, providing their assessment, updating an assessment, what have you. That should not be a spin of the wheel or the magic 8-ball for anybody else to arrive at. Clinical criteria and indicators, documentation, diagnostic options and results and therapies, all of these should be in the clinical documentation. One final, starting point discussion is, people often ask, well, what's the difference between a CDI specialist and an auditor? Okay. And this kind of goes back to that statement that often there's overlap. Often there in healthcare, especially in the administrative end, billing, reimbursement, documentation. Sometimes people wear several different hats, and so there's overlap. But There's probably, 5 different, distinctions between an auditor and a CDI specialist. And the first is focus and purpose. CDI specialists primarily focus on improving the quality and accuracy of clinical documentation in the records. Their goal is to ensure that the documentation accurately reflects the patient's condition, treatments, and severity of illness. Their work contributes to better patient care, accurate coding, and compliance with regulations. And again, you could say the same thing for auditors, but auditors, on the other hand, are responsible for examining healthcare documentation, financial records, and coding for the purpose of evaluating compliance with regulatory requirements, assessing financial accuracy, identifying areas of potential fraud and abuse. And so, one is, and we'll talk about this in number 3, timing. And so, these may seem, number 1, focus and purpose. If you look at a team, a sports team, they all may have different functions on a team, but the goal is to win the game, right? Role in documentation improvement. CDI specialists work proactively. Proactively with clinical staff to clarify and enhance clinical documentation. They often collaborate with physicians and nurses to ensure accurate and complete records. Their focus is on improving the quality of clinical documentation for better patient care and reimbursement. Auditors typically, by design, typically have this wall between them and their subject, at least during the process. Auditors are typically engaged retrospectively to review documentation and financial records. They assess compliance, accuracy, and adherence to coding and billing guidelines. Their role is often associated with financial oversight and regulatory compliance. And it's not that they don't, provide feedback, etc. But CDI specialists are again, proactive or engaged in the process of improvement in real time. Auditors are kind of looking back retrospectively, looking for trends, looking for red flags, etc. So, auditors, probably, we're going to move to timing here in number 3, but timing is one major distinguishing factor that, identifies a CDI and an auditor independently. So, timing of engagement. CDI specialists are typically involved in the healthcare process concurrently, or concurrently with patient care. They aim to address documentation issues as they arise to prevent inaccuracies or gaps. While auditors are often engaged retrospectively after patient care has been provided and claims have been submitted. Their focus is on conducting post-payment or prepayment reviews for compliance and financial accuracy. And, it's also kind of a granular thing too. A CDI specialist is, one of the essential terms in the glossary of a CDI specialist is case. Okay. They're looking at case by case by case, where auditors are looking at more of a body, a universe of encounters to measure overall accuracy, overall trends, etc. So they look at more of a universe of data, where CDI specialists look at case by case by case. The way that the two communicate and collaborate. CDI specialists engage in frequent communication, collaboration with clinical staff. That's one of their main roles, okay? They work closely with the team to ensure accurate documentation and provide education on best practices. Auditors may communicate with various stakeholders, including coding professionals, billing staff, providers, etc. But their interactions are generally less frequent. And they're more again, on a reporting basis. Okay. And goals and outcomes. CDI Specialists, the primary goal of CDI Specialists is to enhance patient care by improving the quality and accuracy of clinical documentation. Their efforts can lead to improved patient outcomes, appropriate reimbursement, and compliance with quality metrics. Auditors aim to identify financial and regulatory compliance issues, potential fraud and abuse, and areas where corrective actions may be needed to, overall, policies and procedure change, etc. So, a lot there is, there's some gray area, there's some overlap, but these are just some general differences between a CDI specialist and an auditor. So that is our introduction, and we are going to be certainly diving much deeper into these different aspects of clinical documentation. I hope this gives you a good starting point, and we will see you in the next module.